Hi there, I'm Dr. Klingler and I'm a colorectal surgeon at Bronson. Colorectal cancer is cancer that involves either the large intestine, which is the same thing as the colon, or the rectum. Colorectal cancer is the third most common cancer that affects both men and women. And so there's a month of March that's dedicated to colorectal cancer awareness because of how frequently it's diagnosed and because we're also seeing an increase in the number of young people who are being diagnosed with colon and rectal cancer. Colon and rectal cancers are both very treatable when they're caught early, but it's a much more serious condition if the cancer has spread to other organs. Patients who have a family history of colon cancer are at a higher risk, and so their screening age typically begins at the age of 40 or 10 years before the earliest diagnosis in one of their first generation family members. Patients also who have inflammatory bowel diseases like Crohn's disease and ulcerative colitis are also at an increased risk of developing colon cancer, so their screening is typically more frequent than the general population. So there's multiple screening modalities for colon and rectal cancer. The most common and probably the gold standard for screening is a colonoscopy. And a colonoscopy allows us to take a look through the colon and see if there are precancerous lesions, which are also known as polyps, and we can remove those at the time of a colonoscopy. There are other things like a Cologuard, which is a fecal DNA test, or fecal occult blood testing. But if any of these tests come back positive, patients need a full colonoscopy to evaluate for cancer or polyps. The recommended guidelines for screening for average risk individuals starts at age 45. So if you're age 45, you're due for your first colonoscopy or to start screening for colorectal cancer. If you have a family history of colon cancer, your screening should begin earlier. This is something to talk with your primary care doctor about, but it's typically 10 years before the onset of cancer in a first generation family member. If patients have questions about colorectal cancer in general or when their testing should start, we're always happy to see you in clinic if you would like to come in and see us here and see some of the colorectal surgeons. Your primary care doctor can also be very helpful in determining when screening should start. And there's also good websites online like the American Cancer Society, which are really helpful to help patients know when they should start screening and what their risks are.